Hi, it's Mary. I'm a therapist and coach, and in this video we are going to talk about my most dearest topic, which I work with every day, and that is trauma. We are going to look at how the trauma looks like, what might cause it, and what it does to you in order to help you realize that maybe you have symptoms in your life, you're struggling with things in your mental health or work or your relationships, and you have no clue why, and maybe you have some unresolved trauma or even present post-traumatic stress disorder, or even identified in your loved ones in order to help them find adequate help and support. And also in the next video we are going to talk about the possible treatments that are right now available in the mental health field to help you treat these problems. And I just want to encourage you that whatever you're experiencing, you're not alone in that, and there are options to help you. So let's get into this. So what is trauma? Diagnostic manual at the moment describes trauma as actual or threatened death, serious injury, or sexual violence. But from the wider context and of course experience of the trauma therapist, trauma can be anything that is perceived by a person as a strong, stressful event or prolonged exposure to any type of abuse, physical, mental, sexual, emotional, verbal, as well as neglect. And also trauma can be not just your own, but by facing or experiencing other close person who has experienced trauma. So it can be also a second-hand type of trauma. So what are the symptoms of trauma, and what kind of disorders or different variations of trauma-related disorders do we know? The most well-known one is the PTSD, or post-traumatic stress disorder. PTSD has several diagnostic criteria that you need to meet in order to be diagnosed, but as with every diagnosis, there is a consensus that changes every year in which symptoms do fall into the category, how many of them you have in order to be diagnosed. But for the purposes of therapy, it's not that important if you fall exactly into all of the categories and checkboxes, but more if you are experiencing symptoms that are hindering you to experience life in full, that are causing you mental health problems and pains and disruptions in your life, and if they have been connected to some stress and abuse that has not been managed in your life. So the first disorder is acute stress disorder. This is something that is very normal reaction to trauma. If you have experienced any kind of, for instance, accident or some violent death or maybe robbing or any kind of strong abuse, as usually one specific experience, after that several hours or several days up to 1 month you can experience the symptoms of stress disorder, and if they last only up to a month, it is called acute stress disorder. But if these symptoms don't leave you, and if you cannot manage them naturally with your own coping mechanisms, and they start to be longer part of your life, then we call it a PTSD. PTSD is a post-traumatic stress disorder characterized by several symptoms. First of all, it is the recurring intrusive thoughts of the traumatic event. These thoughts are coming like out of control in situations where you need to focus or do something, and they come with also a lot of fear and horror sometimes. They disrupt your thinking and your everyday life. Another one is avoidance. You are trying to avoid whatever caused the trauma. It can be avoiding the places, the people, or even avoiding anything similar to that thing. So it can be avoiding not just directly the thing, but avoiding anything that is triggering you, anything that's connected to the traumatic event. Also part of avoiding can be a memory loss, it's amnesia. It can be a selective amnesia that you do not remember certain things, you black it out and you cannot access that. So you may not even be aware of the trauma, but you just experience certain symptoms. Or you are getting these kind of flashbacks, which are also the just like nightmares or flashbacks coming back to you in different situations unrelatedly, out of nowhere. And other symptoms are connected to behavioral changes. It can be, for instance, the disruption of your sleep, insomnia, so inability to fall asleep or inability to have enough of the sleep because you are being woken up by nightmares or just by some feeling of anxiety or different intrusive thoughts that you cannot fall asleep again. Another one might be a withdrawal from your close ones, withdrawal from relationships, and of course might be related to another anxiety or depressions that can develop out of that. So people see that you are somehow different, suddenly you don't get as close to them as you used to. Another one can be reckless or destructive behaviors that were not typical of you before that incident. Another cluster of symptoms are cognitive disturbances, which means the symptoms related to your thinking, like inability to focus. You suddenly have these episodes of losing yourself in time, which can be a type of a dissociation when you lose track of a time, you lose track of yourself or even where you are or who you are at the moment. You may have problems with some memory or with focusing, with learning, or you can have also some disturbances about yourself. You suddenly see yourself differently. You can have negative thoughts about you, about other people, relationships, or life as such. You can be experiencing a lot of anxiety, fear, or even paranoia. And basically it means you are in a constant high alert. You are like in a survival mode, and suddenly something triggers you and you are expecting threat that is not actually objectively there. And because of this threat, you may be very irritable, you may be also very aggressive, and you start to act like you haven't acted before, and people may see that you are unreasonably angry, unreasonably anxious, you avoid situations, you lose yourself, and some other symptoms which are also can be sign of trauma. A post-traumatic stress disorder can be symptoms of dissociation, derealization, or depersonalization, which means basically some part of you shatters away and that part is living its own life, sort of. And that's why the thing is out of your control and it comes up anytime and it's kind of controls you in a negative way or intrudes your life in a negative way. And it may be with the symptoms of depersonalization. It's like you feel like you're detached from yourself. Suddenly you're looking at yourself, or you're not you, or you look in the mirror and it's like somebody else there. Or the derealization is like you don't even know where you are. You lose track of the reality or of the concept of time and space. At the moment, you can have these short periods of these losing yourself, sort of. The symptoms are more severely presented in the third category, which is called complex post-traumatic stress disorder, or CPTSD. The difference is that with CPTSD, it is more complex, the symptoms are more complex, and they result from not just one or two or few separated traumatic events, but they are a result of a long-term exposure to a long-term trauma, usually during the childhood or during the long period of life. So it's usually with children who have experienced a long-term ongoing physical abuse, like severe beating, sexual abuse, especially from the close family members, emotional and physical neglect, and all kinds of like maybe torture or severe types of abuse and exploitation, which were chronic and usually came from close people, and therefore they result also in a deeper issues than only a post-traumatic stress disorder, PTSD. So with CPTSD, again, the three main categories are re-experiencing or reliving the traumatic events in form of these flashback nightmares or these intrusive thoughts and so on. Another one is avoidance of all kinds of situations, relationships, or anything that might trigger that thing. Also including the avoidance in the form of complete memory block and amnesia and not remembering the traumatic event. And the third one is this hyperarousal state, which are the symptoms connected to that alert nervous system constantly experiencing or constantly expecting the threat and therefore being in this state of defense and attack constantly. Also very deep, very significant thing about CPTSD is, as it usually comes from the close people, that is this deep sense of betrayal, this deep sense of lacking any trust towards people and impact on the view of oneself, of their identity, of their value, and usually it distorts tremendously how a person views themselves. They value their meaning in life, their significance, or any rights that they might have. So this is much more severe, because if a trauma happens to a person who had a good background, the person has much more capacity to coping mechanisms and capacity to heal from the trauma. But if the trauma was happening from the close ones and in a long term, in a family, or in a people displacing from foster care from one place to another, or in the dysfunctional families, then it forms a personality of a person. It hurts it in a very substantial way, and it hurts or distorts tremendously how a person feels, how they think about themselves, and how they view reality as such. So CPTSD is such a complex topic that I would like to in future designate one video just to CPTSD. But for now, I just want to include it in this general overview so that you might have an idea what some people around you might experience, or if it happened to you, why it happened and why the symptoms are as they are. One of the typical symptoms is emotional dysregulation, inability to control or operate emotions normally, high levels of comorbidities with other psychological and psychiatric disorders like depressions, anxiety disorders, panic attacks, self-harm, suicidal thoughts and ideation, or even suicidal attempts, and substance abuse like alcoholic and drug abuse is also high, because it's understandable that person is feeling so terrible that they try to sort of medicate themselves with different substances so that they may not feel the pain so strongly at the moment. And another very important group of symptoms are physical symptoms, because the trauma is the unprocessed pain inside of you, and you are alone in that pain, and the pain can try to come out in form of the physical pain, in form of a physical symptom. So it triggers the onset of different psychosomatic disorders like cardiovascular disorders, which is problems with heart, the respiratory disorders, for instance, asthma, gastrointestinal disorders, which means problems with your digestion, problems with muscles, joints, pains, headaches, migraines, different neurological problems, and also hormonal issues, especially with women, issues with the hormonal cycle. So this can be very complex, and the maybe biggest thing about trauma, which I really like from Gabor Mate, who speaks on this a lot, is that the trauma is not just the stressful event that happens to you or happens to a child, but it is a stressful event in which child is alone, or even you as an adult. It's a stressful and hurtful event which you experience alone. And that fact that you experience stress and horror and pain and feeling of helplessness or powerlessness to change it, in combination with loneliness or feeling that nobody understands you, in that nobody shares that pain with you, if there is no help, there is no sharing of the pain in that situation, that is something that locks trauma inside, and our hearts, our minds, our psyche tries to block it in order to prevent us from feeling it. But actually what it does is that we relive it all the time, and that trauma pushes itself out in a different forms, in all kinds of ways, until we resolve it. So the same protective mechanism that maybe try to help us to stop experiencing it at the moment, or to cope with it in a short term, which might be helpful in short term, is very destructive and preventing us to heal it from it in long term. So the main ones we talked about, which is the ASD, acute stress disorder, PTSD, which starts if the symptoms come from months and or longer, and CPTSD, which is complex with more severe and long-term abuse. And then there are some other type of trauma-related disorders, which may not be as obvious or have a little bit different symptoms, but are also related to trauma. For instance, reactive attachment disorder, which happens to children usually who have not a good connection with their parents or caregivers, or their needs are not met and their caregivers don't respond to the needs of a child, and the children develop this disorder, which means they withdraw or inhibit their interactions or expressions. They do not connect, they do not make meaningful interactions with other people, they do not even react to pain of other people, they may be lacking any compassionate response to other people because they haven't experienced it themselves. They can have episodes, sudden episodes of irritability, sadness, fearfulness, anger without any reason, out of context. And also they have a limited ability to experience positive emotions. So if you see a child with these kind of symptoms, if you're a teacher or maybe a friend of some family, and you see this, there is a chance that this child has been traumatized by maybe just an emotional neglect, which means that the parents are not responding to the needs when the child needs help or any kind of emotional or practical support. Another one is disinhibited social engagement disorder. And this is the one that I've seen when I worked in kindergartens in Ireland, where the kids were placed there from a very early age, like 3 or 5 months of age, and the connection with mother's works was completely disrupted. And basically the different caregivers were switching, and there was very little time to actually cater to the really emotional needs of the children. And the children later on, in age of 1 to 3, in the other years, they developed this disorder that they couldn't recognize the strangers. They came to a total stranger and were able to behave to them like this is the closest person in the world. They had absolutely no boundaries, no discernment. They would be able to hop into the car with complete stranger and go anywhere, because their ability to discern who is close or who is not close because of these constantly changing caregivers was completely disrupted. Another type of trauma-related disorders are adjustment disorders, and this is when you experience some highly stressful event, for instance, like death of a loved one person or severe injury of a loved one, or parents are divorcing, or you have suddenly some very severe illness you have to face, like cancer treatment or amputation of a limb or something like that. So this is basically a severe reaction to the loss which is not processed, and also can result in a lot of symptoms like crying extensively, episodes of fear or hopelessness, not enjoying activities or hobbies anymore, not engaging in relationships that you have engaged in before, insomnia again, or neglecting responsibilities at work. You can have troubles to focus on what you need or function at all in a normal life, and also the severe ones are suicidal ideations, thoughts and attempts. So if you find yourself after some stressful event like this having some symptoms, definitely search for help. Don't be alone in that, because the worst thing for trauma is to stay alone. And the last one is unspecified stress-related disorders, which it may be that you don't fall into any of the categories, you don't have enough of the symptoms to be diagnosed, but you still have the problems similar or some of those that I've mentioned. And so that means you need to also search for help, and nowadays there are lots of different types of treatments that are available. So the point of this video is to summarize some kind of symptoms and problems that can come out of untreated trauma. And in another video we are going to talk about those methods and options available for you to help, from different types of psychotherapies, medication or spiritual help and support groups that can help you to get your life back on the track and regain the control and regain the stability that you've lost. So I hope this video helped you. Please like, subscribe and share this channel. Help me grow it and get it to the people to whom it may help in their lives. Thank you very much, and see you in my next video.